Good morning, good afternoon, and good evening, everyone. My name is Danny Nierenberg, and I am president of Food Tank. Food Tank is a research and advocacy organization that really is devoted to telling stories of hope and success in the food system worldwide. We are incredibly honored to collaborate with our colleagues at the Food and Agriculture Organization of the United Nations and the World Health Organization to present this panel focusing on One Health in commemoration of World Food Safety Day, which happens each year on June 7th. Today's event is made available as part of the World Health Organization's Health Talks, which form part of the Food System Summit dialogues that are taking place in the run-up to September's United Nations Food System Summit. World Food Safety Day is a day to really create awareness and inspire action to help prevent, detect, and manage foodborne risks, contribute to food security, human health, economic prosperity, agriculture, market access, tourism, and sustainable development. This year's theme of World Food Safety Day is Safe Food Today for a Healthy Tomorrow. It recognizes the systemic connections between human health, animals, plants, the environment, as well as the economy. And I think this theme is especially important as we make progress on curbing the pandemic in many nations and the horrific surges and even the second, third, and fourth waves of COVID-19 that are happening in many countries. The global burden of foodborne diseases and zoonotic diseases is immense and obviously deadly. But thankfully, there are solutions and ways to prevent the diseases that plague so much of the globe. And ensuring a One Health approach to food safety for all is a crucial way to break down silos in the food system, creating opportunities for farmers, nutritionists, public health advocates, scientists, and eaters to create a dialogue. As the World Health Organization emphasizes, food safety is everyone's business. Our discussion today will focus again on the idea of One Health. One Health is an approach to designing and implementing programs, policies, legislation, and research in which multiple sectors communicate with one another and then work together to achieve better public health outcomes. And I'm so pleased that we have an extraordinary group of panelists to join us today to help explain some of these issues. First, we have Tom Heilandt, who is the Secretary of the Codex Alimentarius Commission, which develops international standards for food under the joint UN Food and Agriculture Organization and World Health Organization Food Standards Program. Next, we have Francesco Branca, the director of the World Health Organization's Department of Nutrition and Food Safety, which is an advisory panel for international standards on various chemicals and microorganisms in food. We're also thrilled to have Carla Schwan, who works at Kansas State University at their Food Science Institute as the lead project coordinator for a U.S. Agency for International Development Feed the Future Innovation Lab for Food Safety Grant. And I'm also pleased to introduce Alan Reilly, who's the former chief executive of the Food Safety Authority of Ireland and previously worked for the Food Safety Division of the World Health Organization. He is currently a professor at the School of Food Science and Environmental Health at the Technological University of Dublin. And last but not least, we have Makaiko Khonje, a research fellow at the MwAPATA Institute. The MwAPATA Institute is an independent agricultural policy think tank based in Lilongwe, Malawi. So I'm so pleased to have you all here. Thanks for joining me. And I do just want to dive right into discussion. And I'm wondering, Francesco, if I can start with you. And I'm wondering if you can tell me a little bit more about this One Health approach to tackling diseases and food safety.
Sure. Thank you very much, Danny, and pleasure to be with you today. Well, One Health, the way we define One Health is an approach to design and implement programs, policies, legislation, and research in which multiple sectors communicate and work together to achieve better public health outcomes. So it's about connecting sectors. But why do we need to do that? Because actually we have been able to document very close interaction between environment, animals, and humans with an impact on human health, animal health, and planetary health. Just to give you an example, we have looked at the latest infectious diseases, the one that we've been able to document, the emerging ones in the last years. And in the last decades, over the 175 infectious SARS that have been detected, 75% came from animals. Examples: Ebola, MERS, SARS, and now most likely COVID-19 is the same story. Why does this happen? Because we have changed this planet. We're using land and sea we've overexploited those resources. We have reduced biodiversity. We've changed the climate. So the whole stress of the ecosystem have created opportunities for these diseases to emerge. So we have created unexpected connections between animals and humans, and food system is at the heart of that. Because we have had to clear land to intensify agriculture and livestock production. We have, through our livestock production systems, overused and misused antibiotics. But also the way we trade food is important. If you just think of the example of traditional food market selling live wild animals, now WHO is calling a ban of the sales of live wild animals, because that's actually creating an enormous risk. But we're learning for the better, for the change, for the future. We have better practices of detection. We're going to have better practices of control, but we need the political commitment to actually make the hard choices for the change of the food system to reduce the impact on the environment.
Absolutely. This has to be a policy issue in so many ways, and it hasn't been. A lot of countries have not been able to make the necessary policies to protect folks from some of these foodborne pathogens or zoonotic diseases. And I'm just wondering how you make those sorts of recommendations.
Yeah, unfortunately, we have not been able to understand all the pathways of action. I think, particularly we're learning more from those who study the ecosystems, how basically encroaching on those environments has generated these consequences. So we, by the way, we have set up One Health high-level panel of experts jointly with the Food and Agriculture Organization, the Organization of Animal Health, and the UN environmental programs, because we want to put together all the science on this. And this is an interesting moment, because governments have realized that unless we take bold action there, we're going to face again another crisis like COVID. In COVID, unfortunately, it's not the end of the stories. There's over 1 million undetected viruses which can suddenly explode. So we need to have a very strong system in place. We've done that for influenza. We now have to do for other zoonotic diseases.
Absolutely. We have to break down those silos. And Tom, I'd like to turn to you. And part of breaking down those silos is really implementing international food standards. Why is that so important?
Well, first of all, it's important, I think, that governments get together, that they have a forum to get together to develop these standards, because we find from experience that only those standards that receive a good consensus within the forum of 189 members that we bring together in Codex, if they find a good consensus there, then they will apply the standard, because we cannot force them, right?
Sure.
Our standards that come out of Codex are voluntary, right? They're recommendations based on science that is provided to us by FAO and WHO, but then it goes to the member states and they need to apply them. And if everybody was involved, right, worked together on this, that creates a network already of countries working together, and it gives more impetus to apply those standards, because they don't serve anybody if we don't use them.
Right. And speaking of those standards, how do you make sure that they are can and should be trusted?
Well, I have to ask you something then, because do you trust science, right? Do you
Absolutely.
There's more and more people who don't trust science, right?
I know.
Which is a bit of a problem. Do you trust your government?
Sometimes.
Well, the standards are agreed by representatives of governments,
Sure.
based on science. So if you overall believe that we can trust the scientific advice from FAO and WHO, you can trust the science, right?
Right.
If you can, like me, if you want to, like me, assume that it's in the interest of governments to keep people safe, and also still be able to trade with each other, I think you can trust them on that, right? It is obviously, you're playing something into an intergovernmental forum, and what we can get out of it can only be as good as the cooperation that we get in that forum. But we're doing our best in order to produce the best country. And I've seen examples of that. It's not that they're not problems, that sometimes people don't agree, right? But in many occasions, we have produced very, very fine standards, I think.
Absolutely. I would agree with that. Alan, I want to turn to you. You've worked in food safety for 4 decades. How do you ensure that the standards evolve over time to reflect that current scientific consensus that we just spoke about?
Well, I think, we have to have at national level, we have to have some form of national scientific committees of experts that will work on the science and will provide the evidence base for governments to formulate policy and produce regulations. We have to be knowledgeable of and participate in the Codex Alimentarius network that has just been discussed. So that's really key when it comes to and agreeing those standards, participating in the international fora, and that makes all our lives easy.
Sure.
But really, what we're talking about here, applying One Health, we're not very good at national level at applying the principles of One Health. Traditionally, sectors like the health sector and the agricultural sector have not always worked, smartly, very closely together. Sure. The medics and the vets, there's always been a little bit of a clash, if you like to call it turf wars between those groups. Now, WHO is producing a new global food safety strategy. And in that strategy, it number one, advocates a One Health approach. And number two is advocating some form of operational management where all agencies that have something to do with food safety work together. So really, this is the plan for the next 7 years that is based upon a One Health approach and all agencies of government working together. It's fairly simple. If you don't have one single database where you are putting or adding in the genetic sequences of different bugs from the food animals, from humans, from wildlife, from the environment, you're going to lose. I mean, it's so simple to do, yet countries really haven't grasped the nettle and put this into practice.
Well, I mean, we've been talking a lot about this issue of breaking down silos, and this is really a question for anyone who wants to jump in. How do we break down the silos on this issue? If the countries aren't talking to one another, if the agencies, I know you're very much trying to get these international agencies to work more closely together, but when you have different countries who are, either not collecting data or collecting data in different ways, how do you get them all to come together on this issue?
Well, I don't know. It makes economic sense for agencies in countries to work together. The investment coming from government in food control systems, to recoup that. Really, if you're not working together, you're getting maximum value for money. But that would be my own view on it. And I may say, knocking heads together within all these different agencies. I've spent quite a long time doing that, but getting them to work together. You see, when the tide comes in, all the boats go up, and that's really the principle. Everybody benefits, and better still, your citizens benefit. And if you're not doing this, listen, it just makes so much common sense. And you look back over the experience that we've had, and particularly with this COVID pandemic, if we're not doing this, if we don't do it into the future, we're not laying the systems down now to prevent the next pandemic. Over to you.
Absolutely. And does anyone else want to comment on this issue of really breaking down silos?
I mean, it totally makes sense also for trade, obviously, right? Because Codex standards, for example, are referenced in the World Trade Organization's SBS agreement. So if you want to trade and you are participating, or you're even asked to participate in Codex and as a country, and to align your standards so that you are able to participate in international markets. Now, you obviously have your citizens, your own citizens first in mind, but you
Sure.
also have in mind that your country maybe has a commodity that they want to trade, and that is important, that your customers know that the food is safe.
Absolutely. Go ahead.
Yeah,
Francesco?
no, I agree with the point that made by Alan. The failure of One Health policies is due to the lack of collaboration between sectors. I mean, we have the theory, but we don't have the practice.
Sure.
Part of it is capacity. So joining, having capacity built across those sectors is going to help. Creating financial incentives is going to help. The governance is very important. I mean, you need to have intersectoral governance. So we can set up mechanisms. The fact that we discuss this issue is in global fora. In One Health is going to be discussed at the G20, has been discussed at the G7. So it means that there is a clear understanding that this cannot be delayed. So action needs to be taken across sectors as a matter of urgency.
Absolutely. Thank you. Carla or Makaiko, do you want to comment on this idea of breaking down silos?
Yeah, so one thing I believe that we need to be open and very honest about what we need to do to improve food safety, what incentivizes people. And as Tom was saying, maybe trade is one of the things. And so if we start talking about issues and how we can promote food safety and what takes people that are willing to change or to implement certain practices, I think that's where we start.
Yeah, we absolutely need those incentives. Makaiko, I want to turn to you because you're coming from the Malawian context, and I'm wondering from your perspective, what is the biggest threat to food safety right now in sub-Saharan Africa?
Well, of course, there are a number of issues that currently they're of great concern when it comes to issues of food safety, but one of them, I think, is issues of aflatoxin. So I'll just highlight some few issues on aflatoxin. And basically, if you look at aflatoxin, this is very common in maize and grain legumes. And then if you look at maize in sub-Saharan Africa, this is a key crop for almost, I would say, like 80% of the region. And then the challenge is that if you look at aflatoxin themselves, they cannot be seen, so it is difficult for consumers to know it. And also you could say, like, if you look at issues of aflatoxin, basically, people can be exposed through eating, breathing, or breathing air near contaminated crops, also consuming meat or dairy products that are exposed to contamination. So if you look at aflatoxin in Malawi and even other bordering countries, basically this could be caused by issues of poor post-harvest handling. We could have issues of too much rains after crop maturity, and also issues of access to early maturing seed varieties, especially in high rainfall areas. And then the biggest challenge currently is that we have limited knowledge on use of AflaSafe. AflaSafe is a product that can basically reduce the contamination in crops like maize and grain legumes, to be specific, groundnuts. So there's also there's low adoption rate for AflaSafe. And we also know that aflatoxin can also cause issues of liver cancer. So I'll also highlight one or two issues that are now very important for Malawi and other countries. For example, recently we have had some of the zoonotic diseases or diseases that are related to fish and livestock. I'll just highlight this also. So if you look at fish and livestock products, these are key products when it comes to addressing issues of malnutrition. However, we see that if you look at animal source foods, this could have what we call like hazardous to consumers. I'll cite a good example in Malawi. Currently, it's still active. We have the red spot disease or the episodic ulcerative syndrome, and this has been a big problem for Malawi, Zambia, Zimbabwe, and even in Botswana, and it is still active. And we have had some cases whereby we had foot and mouth diseases in cattle in the southern part of Malawi. And the memories are still very fresh. I remember in 2017 in South Africa, where a number of people died due to listeriosis. That is contamination of ready-to-eat meat and also milk products. And why this is a threat? If you look at Malawi, Zambia, Mozambique, in most cases, the meat products that we get from our supermarkets, we have a lot of supermarkets that are owned by retail chains from South Africa. So imagine if you have contamination, let's say in South Africa, because of these days we live in a global world, there's high probability that could be translated into even other countries. So if you just go today, like if you look at ShopRite, which is one of the retail giants in Southern Africa, it's available in almost 15 countries in Southern Africa. So assuming that we have some outbreak or zoonotic diseases that could likely threaten the consumers. So in a nutshell, I would say one of the biggest issues currently is issues of aflatoxin, and then also have some zoonotic diseases or other diseases that are related to fish and livestock.
Absolutely. And as you said, this can be a real economic issue. I want to, Makaiko brought up a really interesting point that, food safety is also a food security issue. And Tom, I wanted to turn to you and ask you, what's the relationship between food safety and nutrition, and how does improving one really affect the other?
Well, first, let me get back to an important point mentioned by the aflatoxins. That is really a big problem in many areas. And while there has been a lot of work on that, a lot of work on the reduction of contamination, prevention of contamination, it is still a difficulty, and it might be a rising difficulties in different areas as the climate changes. So this is one of the things that we are fearing will happen as climate changes, that we might get more problem with aflatoxins in other regions where we don't have it at this moment. That's the thing with contamination. It may change, right, over time. You were asking me, well, the relation food safety and nutrition. Obviously, if you imagine you're already living maybe in an area where you have a bad nutrition and you're nutritionally compromised, and then you eat a food that is unsafe and that gives you another problem, the impact on you will be much worse than, and this is what we see. This is what we see in this excellent study, and excellent study, but it gives you a lot of depression when you look at it, of the FERG, of the burden of foodborne disease that WHO did, that it affects mainly the weakest. It affects the children, mainly whose immune systems maybe are not properly developed. So if they eat a contaminated food, they may get very sick or even die, and many of them do. So that there's a really strong relation between that. If the food isn't safe, well, one of my colleagues always says, if it's not safe, it's not food, right?
Right.
And that, again, that leads to economic impact then, because if it's unsafe, then you have to throw it away, or you have to try to reprocess it if you can. But definitely your whole consignment can go to waste. And that's another problem. And that then may lead to food security problems. So this is why we say food safety, whatever you do, make sure that it's safe.
Absolutely. And I was just talking to someone from the Global Alliance for Improved Nutrition last week, and they were saying the same thing. If it's not safe, it's not food. There's no way that, it's going to help anyone. Carla, I want to go back to you, because you've worked on a lot of issues around vegetable contamination. And, so many of the health recommendations are for folks to eat more fruits and vegetables. But if they're not safe, it's not going to help people, especially children, as was indicated earlier. And I'm wondering how you get, both farmers and eaters / consumers to really adopt different practices. Communication is really key here.
Yeah, so I think I'm glad you brought this up because oftentimes we overlook and we take for granted certain practices that we do, for instance, here in the US. And when we go to different countries, you see that those practices are not implemented. And so when I do outreach and education to vendors in wet informal markets or farmers or consumers, I oftentimes talk about the 5 keys to safer foods. And in paper, when you're reading them and talking about them, it's easy concept, but then in real life, sometimes it's trickier to implement them. So I just want to share an example here. One of our mission trips to Cambodia, we were walking through the informal markets and talking to vendors, looking at what type of products they're selling. And for those of you that don't know the wet informal markets that are listening today, they are open air markets. Often they are unregulated and untaxed. And so you'll find a lot of different products being sold in those markets. For example, meats, fruits and vegetables, household products, you name it. And so we were walking at this market and talking about, the 5 keys to safer foods. And one of them that we talk a lot is about separating raw meat and fresh vegetables. And so, yeah, it sounds easy, right? Just let's separate them and we are good. And we are looking at this vendor and talking to her. And we're talking about separating. And she's like, well, but I'm doing this. I'm separating meat from the vegetables. And we look at that stall, the meat was hanging on top of the vegetables. So physically it was separated, but the meat juices were dripping on top of the vegetables. So it really struck me and just made me realize that we might need to take a step back and really think about how we communicate and how we teach and pass those easy practices that in our mind sometimes are easy, but give more examples, be very open and ask questions to see if people are understanding. And so I think that's really key. Consumer education, the workers' education, making sure they understand some of those key food safety practices, really.
Absolutely. Yeah, that education and awareness is key. One thing that I want to ask you all is that, at the beginning of the pandemic, there was a call, not by anyone on this panel, I don't believe, or I believe, but to end these informal or traditional markets, to abolish them so that there wouldn't be, wild animals or domesticated animals brought together in a concentrated area, often in urban areas or para-urban areas. And, from my perspective, that kind of makes me nervous because, having lived in and traveled to the global South quite a bit during my career, I understand how these markets are not just places for people to buy and sell food, but they're also meeting places. They're important social they create a lot of social interaction. So I'm just wondering if any of you have thoughts on, they obviously need more regulation and some standards put in place, but how do we have sort of the best of both worlds when we're talking about these informal markets?
Well, if I can interject, or Francesco, would you like to come in first?
No, go ahead, Alan.
No, I think you're right. Look, these markets are central to the social interaction in many countries. The problems associated with the spread of zoonotic diseases is the practice of taking live animals into the market and slaughtering those animals in areas that have close proximity that the public have access to. So really you have to separate these areas where you're slaughtering animals, whether the animals be wild animals or domestic animals. You just have to separate all of those areas from public access areas, because if you look at this recent pandemic, it would have started in one of these markets, and when environmental sampling was done, the virus was found, in the excretions of the animals, in the cages where the animals were, in the environment where the animals were slaughtered. So really, that practice, needs to stop. And I think Francesco mentioned this earlier on, the banning of the slaughter of those wild animals, and in fact, all animals in areas where the public have access to in these traditional markets. Apart from that, improving hygiene and sanitation standards, really is key, and investing Look, I spent 3 years working in Bangladesh and trying to tackle the problems of the traditional markets. What was one that was very high on the priority of the FAO country manager at the time. And we did spend a lot of effort. We set up areas within markets where we managed to put some drains. We upgraded, the sanitation facilities for washing hands, for toilets, and so on. And people could see that the food coming out of that section of the market was of a higher, if you like to call it, safety than something that was on the ground, close to drains, covered in flies, and so on. So really, that's the issue. It's to separate. Take this. You need a small slaughterhouse out the back of the market where you can kill animals and so on. But just take the meat into the market, upgrading standards of hygiene and sanitation, the drains, pest control, and so on. FAO and WHO have written many guidelines on how this should be done. And so there's no excuse not to do it. You just need investment. You need to educate the policymakers. And somebody needs to champion this whole strategy for upgrading standards of hygiene and sanitation in these markets. Thank you.
Absolutely. So well said, Alan. Francesco, do you want to comment?
No, I think Alan had said it all. Just to add that given the situation, we've actually invested in an analysis of about 10 markets in different countries, or 10 countries where these traditional markets are in place, to do an assessment and also to do plans for upgrading the markets. And of course, the infrastructure in many cases needs to be redone. I mean, these markets are in the middle of cities, large cities, and area of the city is very expensive. So everything is so crowded. So there is an investment needed, but there are plans possible. And during the COVID, one of the important challenges of food security was access to food. So, those markets needed to stay open. And jointly with FAO, we developed recommendation on how to make those markets safer and, improve particularly the cleaning and the distancing of people. So I think policymakers have realized that this is not an optional. This has to be taken up. There's a challenge because it's not necessarily the responsibility of government. Often it's the responsibility of local government, municipalities. Some markets are even outside public control.
Sure.
And so, regulations are difficult to enforce. But, that's the way to go.
Absolutely. Makaiko, I've seen you nodding a lot while Alan and Francesco were talking. And, I've been to some of these markets in Lilongwe and in Malawi. And I'm wondering what your thoughts are on making them, better regulated and, and in some cases more efficient and obviously safer.
Yes, I want also to agree with Alan and Francisco, because the option of banning these informal markets, I think, is a hard one, because I can imagine, even like for middle class people, once in a while, like here in Malawi, we know apart from maybe visiting the shop that is like a standard modern supermarket, once in a while they also visit these informal markets to access other nutritious foods. So I think, to me, I would say, like, what we could make is, like, we could make the informal markets a little bit safer, but by also in terms of investing more in terms of infrastructure. So I think infrastructure is very central to this issue. And then I also wanted to emphasize that, we should also look at the aspects of nutritious foods in this sense, that even this in subsistence economy, farmers would want to get some of these nutritious foods through the informal markets. So if we ban in informal markets, it means essentially we're saying they will not be able to access the nutritious foods. So the other issue that is also maybe paramount is an issue of, like, I know, like in Malawi, we have some places where we have informal markets, but you don't have like a designated border zone. So you can easily move from one country to the other. So if issues of regulations are properly followed with the infrastructure, then I think issues of food safety could be properly dealt with. So in a nutshell, I think we cannot 100% say we ban informal markets, because they also play a very huge role as far as issues of food, access to nutritious food is concerned. However, I think what is important is I think we need to improve on issues of infrastructure, as Alan and Francisco has said.
Absolutely. And I'm wondering, maybe Carla, you can answer this. Is there a role for the private sector to play in making sure that that infrastructure that so many of our panelists have talked about is in place, that those regulations are in place?
Definitely. And I just want to go back to Makaiko, what he was saying, how we cannot simply shut down those markets. People with not only low-income people that access those markets, but people with higher incomes, they access those markets as well, because that is part of their lifestyle, their culture, and the economy really for that country. And so when we think about what could be an incentive besides regulations and making sure people are following them, but perhaps providing them with, I don't know, a safer food certificates for that market, and that we can raise awareness for that community that market is certified on food safety, and maybe that would bring more people and would encourage them to purchase from those markets as well. And then the private industry as well, working with those markets, because sometimes they source foods from those distributor centers or those markets as well. So if they buy foods and they know they're safe, then they are probably best off when they're offering that product along in the value chain.
Right. It just emphasizes how much of an economic issue it is as well. Francesco, when we're talking about food safety, we're not just talking about foodborne pathogens and zoonotic diseases, as important as they are, but we're also talking about chemicals in food. And I'm wondering how our understanding of what is, safe, a safe amount of chemicals in food has changed over time. And what kind of chemicals are we talking about? Is it only pesticides? Is it other chemicals that are affecting food?
No, I mean, we're talking about several categories of compounds. You heard Makaiko speaking about aflatoxins, which are, a particular group of naturally occurring toxins. They're called mycotoxins. But then we also have marine biotoxins. We have poisonous, food and other seafood. We have toxins occurring in poisonous mushrooms. So we need to be aware of this, naturally occurring. But then we also have unwanted byproducts of industrial processes and waste incineration. For example, what we call the persistent organic pollutants, the dioxins, or the polychlorinated biphenyls. You have, when you incinerate the waste, and it goes into the water, and then it goes into food. Or you have heavy metals such as lead, cadmium, mercury. I mean, they get, for example, in the sea, and then they get in fish. We have new contaminants, which we're learning about, microplastics. And then we look at chemicals that are added during processing to see if they're actually safe and or how much is safe. So we have the food additives or residues from food production. You mentioned the pesticide residues from veterinary drugs. So we're trying to see, we're using a process which is called risk assessment. Mm-hmm. So we have committees that look at compounds, and first of all, they have to establish if they constitute a hazard. We then look at the exposure that could happen in different populations, usually through food, but also food and water. And then we, develop some recommendations. So we feed this information to regulators to establish the limits and ensure they are respected. So this is, the next step, which is called risk management. Mm. And Codex Alimentarius is critical for this task, as Tom was saying earlier on. We have consensus with all risk managers about what should be done. But we also need to inform all actors, producers, and consumers through adequate risk communication. So that's the risk analysis process altogether. You asked me what is changing. Well, it's changing a lot because, first of all, our understanding of an increasing number of compounds, and often these compounds are present simultaneously. We need to understand how these mixes work. Then our risk assessment is continuously updated from evolving scientific evidence, biomarkers and biological models. We usually look at cell cultures, at animal models, but also we have human studies. And also our capacity to monitor exposure is improving. I think Tom mentioned the burden of disease analysis, and at the moment our understanding is that 1 in 10 people in the world is somehow getting ill from the contamination of from eating contaminated food, and that's 600 million people in the world alone, and 420,000 die every year. But this is a gross underestimate because our understanding about, for example, chemical exposure is very limited. So WHO has launched a new edition of this analysis of the burden of disease, so we will be able to understand more, particularly around chemicals, and provide this updated analysis. And then Alan was mentioning the food safety strategy. Our understanding is improving, but also our capacity to respond need to improve. And we need to have stronger food system and stronger food control systems that allow everybody to be comfortable about the fact that the food they're buying and they're eating is safe.
Right. This sort of chemical load that you've been talking about, how do you sort of, the large agrochemical companies are very powerful, and their studies on some of the chemicals that end up in the food supply are often, they claim the risk is much lower. And I'm wondering how, you sort of figure that out, how you would work with them when they're so powerful to get the real sort of data that's needed to manage that risk assessment.
Well, yeah, the companies produce continuously new compounds, and we need to make that assessment, and that's what our we have a specific committee called the Joint Meeting on Pesticide Residue. This is work we do together with FAO, and we need to get the exposure data to do that risk assessment. So that is largely available, but then it's the enforcement of those standards by the local regulator, which is important, and that's where we need strong food safety authorities in countries. We need them to be well connected with the agricultural producers. Does it happen everywhere? Well, that's a challenge. I mean, I think this is a question open to all the panelists from the vantage points. I mean, I don't think we can guarantee that that's always happening. I think there are a lot of loopholes in the implementation of these standards.
Sure, and maybe that is a question. I'd love to hear your thoughts, everyone, on what's happening sort of globally on these issues. There, as Francesco said, there are sometimes really strong food safety authorities in some nations, but others are not paying as much of attention.
Danielle, what is important? Sorry, no, just to complement. What is important is also the trade, and if you want to export the food from a country to another, the importing country is also checking, and I think that's one way also to help. Sorry.
No, please.
Yeah, look, the chemicals that we're talking about, the agrochemicals, pesticides and veterinary drugs and so on, they're all approved for use, they're approved such that they will not, if correctly used, will not pose a problem for consumers. So I mean, say that's really important to remember, that when it comes to good agricultural practice, these chemicals are part and parcel of our agricultural system at the present moment. If we didn't have them, crops would be eaten by pests and
Sure.
so on. Animals would end up sick. So I think there is when we do approve them, when you see an E number, for instance, for a food additive, that means it's been approved for use in that particular food, and it's safe for use. And I think that's our food supply has never been as safe as it is today. That would be the bottom line. But when it comes to the enforcement of regulations, let me say, really important. And the new global food safety strategy, as it's probably its number one strategic priority, is strengthening national food control systems, that countries do have the regulations. The regulations are kept up to date and they're enforced. Let me say the jobs of competent authorities is to, audit or to check compliance with regulations. You see, it's the business of the food industry to produce safe food. Let me say these days, the responsibility is placed on food business operators to produce and market safe food. It's the government's job to ensure that they comply with regulations, and they comply with their obligations. Really.
Sure. I'm sorry to interrupt. I guess I'm thinking about, some of the what we're learning, some of the studies that are now being done around, chemicals like glyphosate, herbicides like glyphosate, and that we're learning more about them, that, the sort of unintended consequences of these particular agrochemicals. And companies aren't always, they don't know how safe they are. They're hiding how safe they might be. So how do we kind of handle that sort of misinformation that's out there?
Tom, do you want to answer that? Because I mean, say, your joint expert committee on food additives and JMPR, I mean, say that's the job you actually do in terms of setting global standards for these chemicals.
Well, exactly. And that's basically the reason why we exist, right? The reason why we exist is that in the start, when chemistry came to agriculture and to food production, maybe the industry was a little bit over enthusiastic about the use of certain chemicals. And then the Joint Expert Committee on Food Additives is older than Codex even. It started already in the 50s. So it's their task to study, and as Francesco has outlined, to say what you say. Glyphosate is it's a hot topic. I mean, glyphosate is a hot topic, and the views are kind of a little bit separate about that. For some, this is still a good product that doesn't cause too much harm. For others, this is a product now that is really bad. The truth is probably somewhere in between, right? But again, it depends on your assumption, right? Is your assumption that there is a big conspiracy of big pharma against everybody? Or are you willing to assume, well, actually big pharma and big chemical industry has also led to what was called the Green Revolution, to a lot more production, and it's an important part of food security, right? I think you're in Ireland, right, Alan? So Ireland was depopulated in the past because of the potato, what was it, the blight?
Yes, it was the potato for famine caused by a mold. Yeah.
So something, our modern production systems have given us a lot more food security. They've also given us, and our standards and our food control has given us more safety. So overall, we're not doing too badly, I think, in that. But not in all parts.
If we look to the future, if we do look to the future, I mean, say we now have tools like gene editing, where we can, edit or reassemble the genome for plants to be resistant to some of these things like potato blight. If we had that tool today, the potato blight, if we had it back in 1884, whatever, we wouldn't have had the potato blight in Ireland, because we would have had a disease resistant strains of potato. I mean, say we have some fantastic tools, at our disposal now, looking to the future. Really, what we need to do is ensure that these tools are safe, and we end up with safe food on the plate. But certainly looking at the potential, and if you like to call it the drivers, and looking at our sustainable food system, certainly gene editing and the possibility of developing disease-resistant crops, so we don't need to use these pesticides. Looking at producing, animals that are also disease-resistant. I mean, say that this is a huge potential for the future. I think we may need to rely less on some of these chemicals we're talking about, but provided the technology we use is deemed safe And we have these new products on the market. You know, for instance, we're talking about chemical and chemical contaminants. You have a contaminant called acrylamide, and acrylamide is that chemical. When you fry chips, they go brown. When you toast bread, it goes brown. So, you know, the chemical there is acrylamide. You know, at the present moment, there's one company testing a genetically engineered variety of wheat, which has a lower levels of asparagine, which is one of the amino acids that's important in development of this brown color when you toast bread and you fry chips. So here you have a potential for you know, people to be able to eat nice brown toast and well done chips without the, you know, any level of contaminants from things like acrylamide. So process contaminants are also important, but
Absolutely.
we are now looking for ways and means that for these not to develop in foods. So looking to the future, I think is fairly bright.
Yeah, innovation is key here. With the remaining time we have left, I want to go back to the economic issue of poor food safety. And Makaiko, you know, we've been talking about the health of the population and how, you know, food safety standards are important for the economy and the productivity of workers. But what are some of the other ways that poor food safety or really good food safety affects the economy?
Well, so for Malawi, if you look at the maize is a key crop. It's like a food crop for almost everyone, not only in Malawi, but in other countries like Zambia and Mozambique, and even the Republic of South Africa. So essentially, in that case, if you are eating contaminated maize, it means it's affecting almost the entire population in Southern Africa. So also, according to World Bank, foodborne illness costs low and middle-income countries about $95,000 US dollars. I mean, $95 billion US dollars in terms of productivity loss in each year. So this is a huge loss in terms of these low-income countries. And of course, if you are talking about aflatoxin, basically, groundnut is not as important as maize. However, we know like for Malawi, we totally depend on tobacco, and then this market is threatened by a number of issues such as child labor laws. Memos are still fresh. I think last week we had these headlines in New York Times where the Biden administration plans to ban menthol cigarettes. So in terms of branding of menthol cigarettes, basically they use barley tobacco and flue-cured tobacco. So what it means now that I think for Malawi, we should focus on other alternative commodities, and legumes are alternative commodities. So basically, you'd see like one of the most important things for Malawi is we don't have that capacity in terms of issues of testing and certification. So we are not exporting a lot of products from legumes, to be specific, on groundnuts, because this is constrained by aflatoxin contamination. So in other ways, we are also looking at issue of, because now we cannot export legume-related products to the export market. It means farmers cannot maximize on revenue. So in a nutshell, we would say like those are some of the issues that are very important. And I also wanted to highlight the issue of banning on fish and livestock products within a country and across border. So what is happening in Malawi, if, for example, if we effect a ban on livestock and fish products, what it means that most consumers will not be able to access nutritious foods. And then this could have like a long-term impact on physical and cognitive development in children. And also this could be like a huge loss in terms of income, especially for fish and livestock farmers. And these are the people that they depend on fish and livestock to earn a living. So you'd see that they would not be able to have enough incomes to finance other issues, like, for example, you're talking about paying school fees and also buying inputs. And as a country where we're looking at diversifying away from tobacco, I think if you have any export restrictions on livestock products, it means we cannot earn extra income through livestock trade. So in a nutshell, those are some of the key issues that I think in the long run really affect countries like Malawi.
Absolutely. Thank you. Carla, I'm wondering, when we've talked about point of contamination and reducing risk, that obviously has economic implications. Can you talk a little bit more, about that?
Yeah, so I think just adding to Makaiko, one of the things that I think we overlook is the medical costs that food safety produces. And so if you think and you are sick with a foodborne illness, not only you're not generating income, you're not working, but also you're going to have by the end of the month those medical expenses to pay, and somehow you're going to have to figure out how to pay those. And so as he put it, when we combine medical expenses with the losses of foodborne diseases, I think there was estimated to be $110 billion in lower and middle income countries.
Yeah, it's a huge loss. We have about 4 minutes left, and I want to ask you all to spend about maybe 30 seconds each talking about how the COVID-19 pandemic has changed the way that maybe the world views food safety, from, I think, the way meat is processed. As we saw here in the United States, there were huge closures of meat processing plants, to how meals are prepared because more delivery has been happening, to when meals are really served to customers. So if you could all just go around, I'll call on you. Maybe Tom, you go first.
Well, I think we will still have to evaluate the overall effects. I think everybody has become more conscious of hygiene, of the importance of hygiene. I often say that of all the Codex texts that we have, probably the general principles on food hygiene and the, using the acronym HACCP, which is a system of defining critical control points where you control your food chain and where you test for contamination. I mean, that I'm simplifying a lot, but sure. That has been a very good system to make sure that to keep the food safe along the chain. And that's one of our signature texts, most important. And I think with all the unhappiness that the pandemic has caused, happy that there is more hand washing, that there's more taking care of hygiene. Sure. Even I think wearing masks in supermarkets is not a bad idea at all, right? So we hope that will have positive effects overall on overall foodborne diseases. We cannot say that yet, I think, but we hope that the 5 keys especially will be more used. I mean, there has been more awareness, sure. and that is positive. And also today, as it's World Food Safety Day, we hope that raises a little bit of awareness for that, for the benefit of all. Thank you.
Absolutely. Thank you. Francesco, why don't you go next?
So, yeah, I think definitely it has highlighted the importance of food system and the interconnectedness between health and food systems. We say that this connection is along 5 pathways. It is not only food security and nutrition, but also the safety of food workers, for example. Mm-hmm. I mean, without the food workers were ill, we couldn't have food security. Then it's about contamination of the environment. Then it's about zoonosis, and then it's about food safety. So we've understood how this the way that food is produced is important for us, and we've also understood that we need to handle food carefully if we don't want to have a negative impact on the environment. So again, I think we have understood a bit more the One Health concept.
Absolutely, and I'm so glad you brought up workers. Thank you. Carla, how about you?
Yeah, so I think the pandemic was a wake-up call for us all regarding, as was already said, hygiene, sanitation practices, and really trusting science, because science is what is going to take us out of this pandemic, the vaccination. And so I think just focusing on science and how we can provide innovative ideas to improve food safety, outreach and education, all of those are great points to consider.
Fantastic, thank you. Makaiko?
Well, I'll say we cannot achieve nutritional security without issues of food safety, and we have seen this especially during the COVID-19. So it's very important to look at issues of food safety.
Fantastic. Thank you. And Alan, you get the last word.
Yeah, I think the impact of COVID-19 on the food sector will be number one into the future. We need to rethink our food handling systems, air conditioning, ventilation, because of the way this disease is spread by aerosols. And it will be just as important to have clean water as we have clean air. And the second area is with the whole area of e-commerce. E-commerce is here to stay. People are going to be using these online platforms for purchasing food and other items into the future. And this is going to have big impact on regulations and enforcement and things like food authenticity and food fraud.
Fantastic point. Thank you all so much. I want to thank all of the panelists, all of our viewers who are watching today. I also want to thank the Food and Agriculture Organization of the United Nations, the World Health Organization. I want to remind you that this episode will also appear on our podcast, Food Talk with Dani Nierenberg. Thank you again. I really appreciated this conversation. Happy World Food Safety Day. Please stay safe and well.
Thanks a lot. Bye-bye.
Thank you. Goodbye.
Thank
Bye-bye.
you.
Thank you.